Good greetings everyone. So in this video we are going to be talking about post-mortem examination, particularly about post-mortem examination of production animals. So let's proceed. So first let us define what is post-mortem examination. So the post-mortem term came from a Greek language that means after death. So basically, post-mortem examination means the inspection of the slaughtered animals, basically after they have been slaughtered. According to Catherine Paul King, post-mortem examination requires observation of all parts of the carcass, dressing procedures, equipment, and facilities to prevent contamination of edible parts. So basically this means that post-mortem examination is the inspection of the carcass or the meat to ensure its quality as well as its safety for the consumers. Post-mortem examination will be discussed further in this video as we tackle along how it is done in different production animals. So included in this video, we are going to be tackling about 4 types of main production animals that are being slaughtered. First, we're going to tackle about post-mortem examination of poultry, post-mortem examination of pigs, post-mortem examination of sheep and goats, post-mortem examination of cows and cattle. So first we have the post-mortem examination of poultry.
Examine the exterior. Start by visually inspecting the poultry for any abnormalities on the skin, feathers, and overall appearance. This is an initial step and involves carefully looking at the bird's external features. You should examine the entire body from head to toe to detect any irregularities. Look for the signs of bruising, lesion, or discoloration on the skin. While inspecting the skin, pay close attention to any areas that appear discolored, bruised, or show sign of lesion or wounds. These could be indicators of injuries or health problems. Note any abnormalities or damage to break, comb, or wattles. Pay special attention to the beak, comb, and wattles. These areas can also provide insight into the bird's health. Look for any deformities, injuries, or signs of disease in this. Observe the body cavity. Make an incision through the skin and abdominal muscle along the midline of the abdomen. This incision allows the examiner to open up the abdominal activity and access the organ within. Open the body cavity to ensure the internal organs. After making the incision, the examiner carefully opens the body cavity to reveal the external organs, which are normally protected by the skin and abdominal muscles. This step provides a clear view of organs and their placement within the body. Look for any abnormal odor, discoloration, or unusual fluids. This involves using the sense of smell, sight to detect any abnormalities in the appearance of odor of the internal organs. Unusual smell, discoloration, or the presence of unusual fluids can be indicator of various health issues or disease. Examine the condition of the liver, kidneys, spleen, and the lungs for any abnormalities. This step focuses on the specific organs, including the liver, kidney, spleen, and lungs. The examiner visually inspects these organs to check for any visible sign of damage, disease, or abnormalities in their shape, size, or texture. Any irregularities may indicate underlying health problems. Check the color, size, and the texture of these organs for signs of disease or infection. During this part of the examination, the examiner pays close attention to the color, size, and the texture of the organs being examined. Change in the colors, unusual size, inspect the digestive system. Carefully separate the digestive system from other organs. This step involves the physical isolating the digestive system from surrounding organs and tissues to ensure a clear and focused examination. It's important to avoid damaging any nearby structures during the separation. Inspecting the esophagus, crop, proventriculus, gizzard, and intestine. After separating the digestive system, you should systematically examine different parts of it, such as esophagus, crop, proventriculus, gizzard, and intestine. Look for any obstructions, inflammation, ulcers, or abnormal contents. During the inspection of each digestive system component, pay close attention to the signs of potential issues. Identify the presence of parasite worms in the digestive system. Parasitic infections such as worms can be harmful to the host organism. Inspect the digestive system for any signs of parasites, which may include the presence of actual parasites, eggs, or damage caused by these invaders. Analyze the respiratory system. Examine the trachea, bronchi, and lungs. This step involves a thorough visual inspection and possibly further diagnostic techniques like imaging or endoscopy to assess the condition of the respiratory organs. The trachea is a windpipe that connects the throat to the bronchi, which are the air passage that leads to the lungs. The lungs are the vital organs responsible for oxygen exchange in the body. Check for lesion congregations and abnormal coloration. During the examination, medical professionals are looking for any unusual physical characteristic in these organs. Lesions refers to abnormal tissue growth or damaged congregations, indicates a buildup of fluids and inflammation, and abnormal coloration could be a sign of infection of other health issues. Look for the presence of excess mucus, foam, or any other unusual fluid. The respiratory system produces mucus to trap and remove foreign particles and pathogens. However, an excess of mucus or the presence of foam or any other unusual fluids can indicate problems. Evaluation the reproductive system, if applicable. In the case of female poultry, inspect the oviduct for any abnormalities. The oviduct is a vital part of a female poultry's reproductive system, responsible for the formation and passage of the eggs. Check for the signs of infections, cysts, tumors, or other reproductive disorder. Infection in the reproductive system can be detrimental to the bird's health and egg productions. Look for the cysts and tumors. Cysts and tumors are abnormal growths that can affect the reproductive organs. And observe the size, color, and condition of the ovaries and cloaca. The ovaries are responsible for production eggs, so their size and conditions are important indicators of birds' reproductive health. You should observe if they are expected size, free from abnormalities, and have a healthy coloration. The cloaca is the common opening for the reproductive and excretory system, so its condition is so vital. Assess the musculoskeletal system. Inspect the bones and muscle for any fractures, abnormalities, or signs of disease. Carefully examine the bones and muscle of the poultry for any cracks, breaks, or irregularities. Post-mortem inspection of pig. External inspection. Begin by visual examining the external appearance of pig carcass. This is the first most basic step in assessing the pig. It involves looking at the overall condition of pig's exterior, including its body shape, posture, general appearance. This initial visual inspection can give you a broad sense of whether there are any obvious issues or anomalies. Look for any abnormalities, lesions, or injuries, noting their location, size, and characteristic. You are directed to search for any irregularities or signs of damage on the pig's body. Abnormalities could include things like swelling, wounds, bruises, or any other deviations from a typical pig's external appearance. When you find these issues, it's essential to document their locations, where on the pig's body they are, size or how big or small they are, and characteristic, what they look like, whether they are open source, discolored patches, etc. Pay attention to the skin, hair, hooves, and external genitalia as they may provide important clues about the pig's health. This step specifies several key areas to focus on during the inspection. Opening the carcass. Make a ventral midline incision from the public symphysis to the throat. Ventral midline incision, this means making cut along the center line of the animal's belly running from the public symphysis, the bony structure at the front of pelvis, all the way up to the throat. The ventral midline is the underside or belly side of an animal. Use a scalpel or knife to carefully cut through the skin and underlying subcutaneous tissues exposing the abdominal cavity. You'll need a sharp cutting tool such as a scalpel or knife for this task. It's essential to use a sharp instrument to make precise cuts and reduce damage to underlying structures. Begin the incision by carefully cutting through the skin covering the animal. Be cautious not to cut too deep initially as you want to avoid damaging the underlying tissues. As you cut through the skin, you'll start exposing the subcutaneous tissues. These are the tissues located beneath the skin but above the muscles and the other internal organs. Exposing the abdominal cavity. Continue the incision carefully and precisely until you reach abdominal cavity. The abdominal cavity is the space inside the animal's body where the abdominal organs such as the intestine, stomach, and the liver are located. Abdominal inspection. Observe the abdominal organs including the liver, spleen, kidneys, and intestine. The first step is to visually examine the abdominal organs within the pig's abdominal cavity. These organs include the liver, spleen, kidneys, and intestine. This observation is done to identify any noticeable abnormalities, irregularities, or deviations from the normal appearance of these organs. Check for abnormalities such as lesions, enlargement, discoloration, inflammation, or presence of foreign bodies. During the visual inspection, the inspector looks for various abnormalities that may indicate health issues or potential food safety concern. These abnormalities can include lesions, enlargement, discolorations. Palpate organs gently to assess their texture, firmness, and any abnormalities. After the initial visual inspection, the inspector may use their hands to palpate, touch, and feel the organs gently. This hands-on examination allows them to assess the texture and firmness of the organs, as well as to detect any abnormalities that may not be visible to the naked eye. Palpation is a crucial step because it can reveal issues that might not be apparent through visual inspection alone. Thoracic inspection. Make a transverse incision across the diaphragm, exposing the thoracic cavity. The first step involves making a horizontal incisions transverse across the diaphragm, which is the muscles that separate the thoracic cavity in chest from abdominal cavity in belly. This incision is typically made near the midline of the pig's body. By doing this, you gain access to the thoracic cavity. Expose the thoracic cavity. After making the incision, the diaphragm is cut open allowing you to access the thoracic cavity. This cavity contains several important organs including the heart, lungs, or other structures associated with the respiratory and circulatory system. Head inspection. Carefully remove the skin from the head, exposing the skull and brain. Begin by preparing the pig's head for inspection. This typically involves removing the skin from the head, which allow for more thorough examination of the underlying structures. Expose the skull and brain. After removing the skin, you should be able to see the skull and brain This step is essential because it allows for a closer examination of brain and its surroundings. Inspect the eye, nasal cavity, oral cavity, and ears for abnormalities such as infections, tumors, or foreign bodies. Examine the pig eyes for any abnormalities. Look for the signs of infections, injuries, tumors, or any other issues that may affect the pig's vision or overall health. Carefully examine the pig's nasal cavity for any signs of abnormalities. This could, in- this could include evidence of respiratory infections, foreign objects lodged in the nasal passage, or other issues related to the pig's respiratory health. Open the pig's mouth and inspect its oral cavity. Look for dental problems, sores, ulcers, or any other abnormalities that may affect the pig's ability to eat or indicate the underlying health issues. Examine the pig ears for any signs of infection, injury, or parasites. Ear issues can affect the pig's balance and overall being. Remove the brain by using a bone saw to cut through the skull and examine it for any signs of encephalitis or neurologic disease. Remove the brain. To thoroughly assess the brain, it is necessary to remove it from the skull. This is typically done using the bone saw or similar tool. Once the brain is exposed, carefully examine it for any signs of encephalitis, inflammation of brain, or other neurological disease. Abnormalities in the brain can be indicative of serious health problems in the pig. Collect representative sample of any abnormal findings or lesions for further laboratory analysis. During the postmortem examination of pig, if any unusual or abnormal features such as lesions or anomalies are observed in the internal organs or tissues, it's essential to collect samples of these abnormalities. This is done to further investigate and analyze the nature of these abnormalities.
Next, we'll have the post-mortem inspection of sheep and goats.
Fully examines the external features of the carcass, such as the skin, eyes, ears, and feet, looking for any abnormalities, lesions, or signs of trauma. They also inspect the internal organs, including the lungs, heart, liver, and kidneys, to assess their health and to identify lesions or abnormalities. Postmortem on a goat. To observe the dead goat, try to question yourself if the goat struggled before death and what was lying on its side or internal position and why it's bloated more than you expect. Do an external examinations. Get an idea of the body condition of the goat. Check the body openings for any discharge, nose, eyes, mouth, and anus. Check the color of mucous membranes. Look inside the mouth. Check lips, teeth, tongue. Feel the gut to see if any gas or any fluid occurs under the skin and indication battle jaw or swelling. Cut the tissue muscle attaching the front and head right legs and reflect them away along the belly and reflect it back. Check for any edema under the skin, the color of the tissue, any bleeding. It is important to examine the carcass if there's a signs of symptoms of edema. Sternum and push back the ribs to crack and so open the thorax and expect the contents in place. That's the inspection of abdomen. And when you check the abdomen, also check the individual organs. Kidney. The kidney should feel solid, hard when pressed, and have a darker, deep red outer cortex. Mossy kidneys may indicate pulpy kidneys. Why kidneys should be felt solid? If it's smooth, there are symptoms of cases of pulpy kidney if it's soft. So It should be feel solid. Then the liver, a first water finger, the depression returning to normal. It should be deep red with no variation. The texture should be moist and make a nice clean cut. The edge should be sharp, rounded edge maybe indicate swelling of the liver. Spleen. The color is dark bluish red and many white speckles cover the surface. Its texture is like that of the liver. If the spleen is much enlarged and if the white areas protrude, then there is evidence of abnormalities there. Stomach. Examine the outside of the rumen for bleeding, wounds or abscesses. Open the rumen and check for amount and age of food inside. Should be fairly fresh. Ulcer or wounds in the lining. Abnormal items such as plastic bags, pieces of wire cloth, itcher and parasite. When the milk stomach and examine for ulcer and parasite, warworm and brown stomach worm occur in the abomasum. The brown stomach worm, however, is so small that lymph nodes. Examining mesenteric lymph nodes for enlargement, possibly due to external bacteria and other lymph nodes. For sign of enlargement, or in this case, the enlargement mesenteric lymph nodes can be seen suggesting a chronic intestinal tract stimulation. Heart. Check the precardial sac for clear or bloody fluid. In some cases, pulpy kidney pasturilla, the clear fluid may clot and exposure to air. Check the surface of the heart for sign hemorrhage, plant poisoning, and heart water, pasturilla, and clostridia infection as examples. And so the lungs have check the lungs for color, consistency, and any adhesion to thoracic wall or heart. In cases of pneumonia, the lungs are dark red solid and feel thick on palpation, mainly in the anteroventral lobes of lung.
Good day everyone, and I'm going to discuss to you today the post-mortem inspections of the calves and cattle. It is a procedure of a veterinary that involves the examination of the carcass and internal organs disease of calves and cattle. It is also performed by a veterinary or a trained professional to determine the cause of death and, and to assist the overall health of the animals. And here are the 9 steps of doing the post-mortem inspections. Step number 1, preparation. Preparation, it is important to be prepared of doing these inspections. It has also necessary equipment like gloves, sharp knives, specimens containers, and labels. And also we need a well-ventilated area or in a cool area of doing these inspections. And also have enough space for, for accommodate the animals and allow us to work safely. Step number 2, examination of the external surface. Start by examining the outside surface of the carcass and look some abnormalities such as sore, swelling, or signs of injury. Take note of this observation. Step number 3, opening the carcass. Of doing this process, we should wear gloves and use a sharp knife to cut the abdomen. And take note to be careful not to puncture any organs during this process. Step number 4, assessing the abdominal cavity. Open the abdominal cavity by lifting and cutting the abdominal muscles and diaphragm. And also note of any fluid or gases that present in there, as well as any signs of abnormalities in the appearance of the organ. Step number 5, examining the external organ. Let's begin to examine the organ of the abdominal cavity. Begin by evaluating the gastrointestinal tract, which includes the stomach, small intestine, and the large intestine. and look for any signs of inflammations, ulcerations, or foreign body. And, and then check the liver, spleen, and kidney for abnormalities in the size, texture, or color. And after that, evaluate the lymph nodes of enlargements or discoloration. And then, and then examine the reproductive organs including the uterus, ovaries in women, and testicles in men. And lastly, check the lungs and hearts for signs of pneumonia, fluid buildup, or abnormalities in the heart valves. Step number 6. Sampling. Sampling. If you suspicious or a diseased tissue is detected, take a sample for examination and use a sterile sample container. Label it appropriately and include the relevant information such as animal identifications, dates, and locations. Step number 7. Documenting findings. While doing the postmortem inspections, document your findings, take photographs, and make a detailed notes. Step number 8. Closing the carcass. Once the inspection is complete, carefully close the carcass by suturing the abdominal muscles and skin using a large curved needle. Lastly, disposals. Ensure that all contaminated materials such as used tools, potentially infectious tissues, and gloves are properly disposed according to biosecurity regulations and procedures.
So that concludes the sequential steps of post-examination of different production animals after slaughter. To briefly summarize all of the steps that are regarding in each different animals that are tackled, so we basically have first the cleanliness, the sanitation of everything involved in the inspection, the materials, the animals, as well as the meat facility itself. The carefully observation, then the careful cutting open of the carcass, the observation where there are abnormal discharge or foul smell or any indication of potential health risk or abnormality, and as well as the documentation of the animal. So that concludes the sequential steps in postmortem examination in different animals. So now let's proceed to the case analysis. So as you can see, Calbayog City aims for independent meat industry. So the National Meat Inspection Commission, or NMIC, and Department of Agriculture Regional Office provided assistance in this project through taking part in funding from the former and the latter donating high-priced equipment as a means of support for the objective of developing meat production in the city. So this news in Cavite City is published during this year back in April. So basically what happened was in this project, the former administration had an objective of improving the meat production here in Cavite City so that we don't have to import much from the other cities. So we don't have to be too dependent from the production of other cities that supply our meat needs here in the city. To have a little bit of background of the meat production industry here in Calbayog City, Calbayog City is not quite well off in terms of meeting the needs of the required meat production here in the city. That's why we are importing from other cities. Our main suppliers of meat was mainly our Masbate and Jensen from Saxarjan. So that's where most of the meat came from that is being imported back. To provide action in order to address the problem, the administration assigned a line of task force that will assess and put to action what they have been looking forward for in terms of the meat production. Improving the meat production is the main objective of this project because we do not have enough supplies here in the city alone. That's why this project has been conducted. So the DA, the Department of Agriculture Regional Office, provided assistance and showed their support by participating in terms of turning over a high price weighing scale, a digital scale, to the city veterinary office. So, and also the NMIC provided partly showed their support in terms of funding partly through this project. In line with this objective, the DA also conducted a 2-day conference with producers of livestock in Calbayog, during which they were urged to look beyond the city's border for new and bigger markets in order to achieve growth. So as you can see in the picture, this this is the high price weighing scale that is turned over from the Department of Agriculture Regional Office. So you may be wondering what is the relevance of this case or this project to our topic, which is the post-mortem examination. So aside from the steps taken in order to boost production of meat here in our city, so these facilities will provide proper secure and hygienic environment for the meat, as well as it is where the inspections of the meat is going to take place. These facilities, although this information is still be confirmed and it's still an ongoing project, so we can only hope for the best and for good results, so that they can address the problem of Kalpay City having less less production of meat than required of the locals. So next we will move on to the market trees. So next we will move along with the market research of post-mortem examination. So first let us discuss the economic importance of meat inspection. So in brief definition, economic importance means how the meat production affects the economy, or in terms of financial value, and how it generates income. So first we have to ensure the safety of the meat during importation. So actually this is under the Republic Act number 9296, or the Meat Inspection Code of the Philippines, which is amended by the RA 10536, which states that the meat should be inspected for and escorted properly during importation. Next, to guarantee the quality of the meat, to avoid the risk of foodborne pathogens or potential health risks. So basically, these are all under the Republic Act number 9296, as mentioned. So basically, the Republic Act states that there are the Republic Act states that the meat should be carefully inspected in a hygienic facility or by licensed veterinary. All this revolves around the the following of the Meat Inspection Code of the Philippines, as well as it is a means of prevention of economic loss, because without meat without proper meat inspection, foodborne pathogens or potential health risks or anything that can affect the quality of the meat will also affect it its its marketing value. Therefore, the safe conduct of slaughter and inspection of the meat after it has been slaughtered is very important to prevent the economic loss. So there has been an instance wherein uh, a big uh, a big facility of meat of pork meat product pork meat supplier lost 14% of their income because of the ASF, because of the infestation of the ASF. So they were punished for ASF for selling hot meat, which is very illegal and and can be punished with a fine for a 6-year imprisonment. So in line with the mentioned economic importance of meat inspection, it is also important to target to find your target market. Therefore, the the target market of these meat inspectors are those facilities, especially in private or bigger companies that produce meats that that will be soon transported to supermarkets. Like those suppliers hire these private inspectors of meat or get get them from licensed licensed veterinary office that are given permission to conduct an inspection to their meat. So that is the importance of meat inspection that that also includes the post-mortem examination. So that concludes our presentation about post-mortem examination and hope you'll have a good day.